After I arrived at this conference center, I have listened to many excellent endeavors, efforts to reduce suicide in Taiwan. But let me humbly share what we have been doing in Japan. No conflict of interest. I will speak about suicide in Japan, suicide in the world briefly, suicidal process, suicidal prevention. I don't have to preach you very shortly. But then, evolution of policy focus in Japan, and more specifically, Action J project is to help high-risk people after their attempts. And as a population-based approach, Japanese government started to implement Gatekeeper project. I will speak about it. But unfortunately, with all the efforts, suicide among youth is an issue in Japan, like in Taiwan or in other parts of the world. Japan currently has 128 million population, and I guess you know, in '98, the suicide in Japan dramatically jumped by 35%, and from '98 to 21, the number of suicide exceeded 30,000 in Japan, so it was a very dark era for Japan. And following the economic, there was an economic crash in Japan around that time. Following the economic crash of the late 1990s, the suicide rate in Japan increased to a rate of over 30,000 people per year, and has been one of the highest in the world. Cultural factors have influenced this high suicide rate, such as the tradition of honorable suicide, as well as a permissive attitude towards suicide that remain in modern times. Traditionally, you may know that we had a tradition of seppuku that samurai killed. With honor, they kill themselves to save the face of their superior or the family. And such mentality still slightly remains in Japan. Additionally, the economic downturn, particularly the trend of unemployment in middle-aged men, also plays a significant role in the high suicide rate. So this is the annual trend until 21 or 22, and here, this one probably, yeah, this is the dark period of Japan. And this is the rate, and rate for male is clearly higher than female, and this was a dark era rate. Suicide in the world, just briefly, but compared with the other G7 countries, Japan was had a clearly higher rate. And globally, Japan belongs to a highest rate group. Taiwan seems to be better. And worldwide, many people who commit suicide has mental illness. I don't have to preach it. We know it. Now, suicidal process, again, this issue has been already explained to you in the previous presentation. Life event happens, bankruptcy, loss of job, blah, blah, blah. But there is a pathway, and if the process is unfortunate, it may lead to suicide. This and other slide by Professor Cho. Professor Cho and Professor Kawanishi are two leading suicidologists in Japan, and they helped me to, by providing these slides. So this is the life event and lack of support. This is the pathway. Then the person's condition ends up in depression in a large sense, and then the process may lead to suicide. Relationship between mental disorder and suicide. In the case of depressive illness, there may be direct effect of symptoms or hopelessness due to stigma associated with mental disorders. For example, especially for schizophrenia or dementia. And other risk factors for suicide due to impaired social function caused by mental disorder. For example, the person may be divorced or may be unemployed or dismissed. And as you know, Horton described the psychological autopsy as a difficult but highly informative and the most productive approach to study suicide. And he said that the crucial point of the psychological autopsy is the cooperation from family members of suicide victims. Of course, their family is under sadness and various stresses, but still their cooperation is indispensable for significant, meaningful psychological autopsy. Suicide prevention, as was presented, there are two main approaches to suicide prevention. And one is a population approach, and this is support for the general public. And the second is high-risk approach, which consists of care for high-risk individuals. So, population approach is try to work with the background situation, background stress situation for the general public, trying to decrease life events, bankruptcy, loss of job, bullying, COVID, divorce, death of partner, illness, discrimination, others. And also, population-based approach should improve support so that the support is not insufficient or to avoid additional risk factors. But inevitably, some people have depressive conditions, and they become a high-risk population due to depressive symptoms or other mental disorders, and then high-risk approach should be provided to this population. To save Japan from that dark period, government decided to take action to promote suicide prevention. So 2001, you remember, 98, the suicide rate jumped. So 3 years after that jumping, the Ministry of Health, Labor and Welfare prepared a budget for suicide prevention for the first time. And at this time, the budget was mainly used to support crisis helpline such as Federation of Inochi no Denwa Lifeline in Japan. The next year, the government, Ministry of Health, released a report on national suicide prevention strategies. The 2006, the Diet approved the Basic Act on Suicide Countermeasures. And in 2007, so from 98, this was 9 years after that jumping, the start of the dark era, 9 years after, the first National Suicide Prevention Center was established and the cabinet set the Comprehensive Suicide Prevention Initiative, and the cabinet officer coordinated the implementation. And this was the premise of Comprehensive Suicide Prevention Initiative 2007. The first is suicide is death as a result of being driven to desperation. This is not the result of an individual's free will or choice. Various factors are intricately involved. Many suffer from mental illnesses. Suicide can be prevented. Establishment of consultation and support systems, appropriate treatment for mental illness. People who are considering suicide show signs, so the importance of awareness by family and colleagues. And this is the orientation of the comprehensive suicide prevention, to make every citizen a key player in suicide prevention, to provide post-suicide support to survivors and bereaved families in addition to suicide prevention and crisis response, to work together to provide comprehensive support to clarify the actual situation, to take a medium to long-term perspective and continue efforts on an ongoing basis. So this was the orientation of the initiative. Now, more concrete policy focus. To clarify the reality of suicide by research, to deepen citizens' understanding and awareness of suicide prevention, and later this will lead to Gatekeeper project. To secure and train human resources, to promote mental health, to develop mental health services, to act on social factors, to support suicide attempters, to support bereaved, to support activity of NGOs. Annual budget. Though Japanese government has a huge deficit financially, but the government increased the budget drastically from 2007 to 2015 for suicide prevention. The purpose was, again, investigate the real motivation of suicide, promote public awareness of the signs and risks of suicide, give training to the gatekeepers of suicide prevention, promote mental health, increase appropriate psychiatric treatment, build up social activity to prevent suicide, care for suicide attempters, care for the bereaved people affected by suicide, facilitate the collaboration with NGOs. Now, the key points as considered by suicidology leaders, such as Professor Cho and Professor Kawanishi, their concepts are both high-risk approach and population approach are important. And a combination of these two approaches is necessary. And medical treatment and social support for high-risk persons should be effective and efficient. Screening of depressed persons and care for them in local community can contribute to suicide prevention. And then evolution of policy focus. The policy focus has been developing slightly. The Suicide Prevention Initiative was first established in 2007. 10 years later, 2017, the Japanese government added another item, strengthen support for practical initiatives at the local level. Also in 2017, in addition to appropriate mental health care, the government added the wordings, mental health care and welfare services. And another item, reduce the overall risk of suicide in society. Another item, further promote suicide prevention measures for children and young people. This year, 17, these children and young people was first explicitly mentioned as the policy focus. And further promote suicide prevention measures related to work issues. Workplace issues is again, for the first time in this year, explicitly mentioned. 5 years later, 22, then women, the issue was added, further advancing suicide prevention measures for women. And this year, 3 years after, this year, school responsibility and expanding training for mental health professionals were added. So the policy focus have been developing in Japan. And Action J project. Action J project is an intervention program for the high-risk population, which consists of periodic contact with the participants during their stay in the emergency department and after discharge, collection of information about each participant's treatment status and social condition, encouragement of participants to adhere to psychiatric treatment, coordination of appointments with psychiatrists and primary care physicians, encouragement of participants who discontinued psychiatric treatment to return to treatment. Referrals to social services and private support organizations and coordination for use of these resources to accommodate the individual needs of patients. Provision of the psychoeducation content and information about social resources through a dedicated website. And Professor Kawanishi has been leading this Action J project. So this Action J project is done mainly at the emergency department, and emergency department physician or nurse and other staff are involved as a crisis intervention and psychosocial education and treatment. And based upon the Action J project, there are training program is established with content on suicide prevention lecture, assessment for suicide risk group work, suicidal communication with suicidal individuals, lecture and role-playing, case management, lecture, role-playing work, psychoeducation, case management, follow-up session, case management, response to incidents, care for bereaved, multidisciplinary team model, self-care for the staff, set up for implementation of the intervention. And for Action J project, Professor Kawani, sorry, this is Professor Kawashima, but Professor Kawanishi and his group have been doing extensive research upon the effect of the Action J project, and this is the evaluation of the training course. This is sample 322 methods, result, self-efficacy and suicide prevention skill turn-up improvement, and the negative attitude towards suicide prevention decreased, and irrespective of professions and experiences. So the training was effective for the trainees. So this is one research result. Another more important research is this. The upper red line is this is slightly enhanced, but basically ordinary care. And this is the lower figure is the Action J represent the patient who received Action J plan support. And this is a risk of repeated suicidal attempts, and so there was difference, effectiveness of the Action J support for the patients. So, as a result of these extensive researches, Action J intervention program was adopted in medical payment system in 2016. If you do training, if you receive training, Action J training and provide Action J support, then you get reimbursed for your service. Hospitals that engage in consultation, liaison circus, psychiatry services can also charge, and the attendance of the dedicated two-day education course is necessary for staff of the hospital. These are the requirements for the payment. Actually, in Japan currently, the suicide prevention related medical activities are reimbursed in several ways. Psychiatric intervention for suicide attempters at emergency medicine, liaison consultation services in general hospital, psychiatric consultation for outpatient clinics, and based upon Action J study, assertive case management intervention for suicide attempters transported to emergency unit, started in 2016. High-risk maternal co-management and kokoro renkei connectiveness of mind, cooperation with mental health treatment. This was added in 22. So if you do suicidal prevention related activities at the medical facilities, there are ways that your activities are reimbursed. And Gatekeeper project, and as I spoke briefly, the concept of Gatekeeper project was already seen in 2007. However, the actual practical implementation started only recently. So recently, the local prefectures started to provide in-person training, but also the e-learning is now also available. And the 5 key points of a Gatekeeper project is awareness of risk signs, listen without judgment or criticism, provide reassurance and information, encourage seeking support, and also self-help for the gatekeeper who try to help others is necessary too. Let's prepare ourselves mentally to engage with others. Let's respond with warmth. Let's convey our sincerity by listening attentively. Let's listen carefully without negating what the other person is saying. Let's acknowledge the other person's past struggles. Let's convey our concerns. Speak clearly and slowly. Thinking together makes support. Preparation and skill development are also important. Know where to turn for help, such as counseling, if you, gatekeeper, find yourself in a difficult situation during a conversation. Taking care of your own health, gatekeeper's own health, and seeking advice for your own concerns are also important. Lastly, Gatekeeper project started, but the effect is not yet known. Suicide among youth, this is the figures for primary, junior high, and high school students, primary students, and junior high, and senior high. And if we add everything, total is this. And unfortunately, we see the upper increasing trend. So this is last year's suicide prevention white paper. So that's the reason why the government added responsibility of the educational facilities in the 25 amendment revision of the project. These findings highlight the urgent need for comprehensive mental health support system tailored to Japanese cultural context. Recommendations include enhancing access to school-based counseling, promoting family-based intervention, and implementing policies to regulate harmful online content. Additionally, efforts must address cultural attitudes that stigmatize mental health care. Collaborative society and policy-level interventions are crucial for mitigating youth suicide and fostering a supportive environment for young people in Japan. This is a research paper last year. So, summary. Suicide in Japan surpassed 30,000 between 1998 and 2011. The Japanese government has enacted laws and carried out various national projects. And as high-risk approach, Action J has been proven effective and now incorporated in treatment scheme, paid treatment scheme. As a population approach, Gatekeeper project has been has started, but the effect needs to be seen. And suicide abuse is a serious issue in Japan. Thank you very much for your attentive listening.